My name is Shtern. I'm a physician and founder of the AdMeTech Foundation, a nonprofit organization providing leadership for groundbreaking programs in prostate cancer at the state, national, and international levels. Our programs have been transforming prostate cancer care for everyone and reducing health disparities in Black, Hispanic, and Latino men. I am grateful to Brockton and ACP for a long-term partnership that was born in 2015 and made it possible for us to have multiple joint programs, including our event today. I'll briefly review AdMeTech's prostate cancer program and focus on our equity resource project. AdMeTech prostate cancer programs created a Massachusetts model of national leadership in public awareness, medical education, and research and clinical care equity. We are grateful to Governor Healy, President Spilka, Speaker Mariano, and many other Massachusetts legislators who made this program possible. In particular, I'd like to thank members of the Brockton delegation to the State House who championed our program, including prostate cancer awareness event we have today. Our primary focus is on high-risk men, Black, Hispanic, and Latino individuals, and all men with family history of prostate cancer and increasing age, 50 and older.
This program was initiated since 2009 in collaboration with multiple organizations and has 4 components: public awareness and community education, prostate cancer equity resource in clinical care, medical education, and research.
Our public awareness and community outreach is focused on the most vulnerable and underserved individuals. Since January 2025, we reached over 20,000 underprivileged individuals. Since 2019, our public awareness and education program reached over 80,000 people. The main emphasis of our public awareness effort is on the importance of early detection, critical for saving lives. Dr. Guy Fish is one of our medical partners in public awareness. He is CEO of the Codman Square Health Center and member of the Boston Board of Health, governing Boston Public Health Commission. He could not join us today, but sent an important message.
This is Dr. Guy Fish. I'm pleased to be speaking with you today at the AdMeTech conference with respect to prostate cancer, a topic which is near and dear to my heart. I have a few simple messages to communicate to you this morning. The first is that prostate cancer is something we should all take seriously. But if you have a father, husband, son, uncle, then you also need to take prostate cancer seriously. Why? Because, let's face it, men have a hard time taking their own health seriously, and we need a little help. So, ladies, please get in the game with us. Number 2, what is prostate cancer and why should we talk about it? Well, prostate cancer is among the leading causes of death for men in these United States, and it particularly is hard on Black and brown communities. The number 1 cause of death for men, well, it depends on how old you are. For Black and brown men under the age of 50, gun violence is certainly top of the list. But beyond that, we have the usual mortalities around cardiovascular death and cancer, and leading among cancer is prostate cancer in men. So let's take it seriously, because every time that a man dies prematurely of prostate cancer, that's a father, son, uncle who's not around to be at our birthday parties, at our celebration events. So let's make sure that generational wisdom and wealth and knowledge is passed down to our generations because they're around, not dying prematurely. So what is a prostate, and what does it mean to have prostate cancer? The prostate is a gland that is involved in the men's urological system. It's about the size of a walnut. It sits underneath the bladder, and it provides lubrication for sperm as they usher forth to produce children. Now, that gland is going to be there from the time that a man is born to the time that he dies. And along the way, it, like most organs in the body, those cells know what they're supposed to do. They're supposed to produce the fluids that I mentioned. They're supposed to reproduce themselves in an orderly way and die off in an orderly way, just as liver cells and kidney cells and heart cells do all the time. But in the prostate gland, there's a possibility of cancer developing. And cancer means that the cells have forgotten who they are. They've forgotten certain rules about not continuing on forever, acting like they're immortal. And when that happens, they grow and grow and grow, and then they make a tumor, which can then seed other parts of the body and into places where it shouldn't be, such as the liver or the lung or the brain. So what we want to do when we are able to is to use the tools and technologies that God has made available to us through human intelligence to detect prostate cancer early. Early detection and prevention are the keys to getting to better outcomes with respect to any cancer, but particularly for men in prostate cancer. So the good news is that it is actually fairly easy to detect prostate cancer early on. What is that and how do you do that? Well, the first thing you need to do is, again, recognize that you should be checking up on your health with your doctor. So men, let's schedule those doctor's appointments. We know we don't do that, but we really need to get a scheduled doctor's appointment. And in that doctor's appointment, ask them to please check our prostate. Why? Because African American and brown men have a higher rate of death from prostate cancer. It's not that our biology is different. It's that largely we don't let it become detected until it's too late to do something about it. Most men who have a prostate that is developing a tumor will probably die of other things many, many years later. But some may require surgery because it's moving aggressively or is at risk of spreading. And in that case, there are prostate surgeries which are done mostly robotically these days and minimally invasive, so you don't have to have a big scar like in the past. So what I'm describing is a journey which should engage you in terms of your desire to be here for your children, your grandchildren, your wife and family. It isn't scary. It's just a necessary type of screening that you need to do to be mindful of how you are doing, how your body is doing. You need to take ownership of that. The most important thing of everything that I'm saying is that you need to own this. You need to be an advocate for your own well-being. If your PSA and your prostate exam are going up, you may want to have more specialized testing done. There are new tests that are on the market which are helpful in determining which of these tumors are actually aggressive and which ones are pretty indolent, and you can let them sort of not be bothered with for a while until it changes its characteristic. But you really have to be an advocate for your own health. And that's the most important differentiator between the outcomes in Black and brown communities and the majority of population. How aggressive are we being? Making those appointments, speaking to the doctors about what we want, and following up on those test results. That's up to you. And it's really up to you to ensure that you're here for your loved ones. So my personal history, my father died of prostate cancer. It was detected a little bit too late for much to be done. He was someone who, like most men, didn't really get his physical exams in on a regular basis and went on to pay the consequences. So I don't want that for you. I just had my annual exam last week. My PSA is in a normal range, thank God. And I will check it again next year. So I hope that when next time we meet, you can tell me that you've done the same.
The centerpiece of our medical education is AdMeTech's annual Global Summit on Precision Diagnosis and Treatment of Prostate Cancer. The latest 9th annual conference took place in September last year. Over 400 physicians took part in this event from just about every corner of the globe. Our media partners published over 60 scientific presentations, reaching over 35,000 international clinicians. Our summit brings together the key international experts representing every clinical expertise to review the best emerging clinical practices and research priorities. Indeed, our summit has been recognized as a seminal event in shaping the state-of-the-art and future vision for patient care. It is difficult to find any corner of the world that has not been reached by this event. In our research, based on the summit recommendations, we focused on image-guided, minimally invasive treatment of prostate cancer. These procedures are called male lumpectomy to draw a parallel with minimally invasive treatment of breast cancer that has been available to women over 25 years and replaced radical mastectomy. Accurate imaging, including MRI, makes it possible to identify and remove prostate cancer while sparing surrounding normal tissues. This is in sharp contrast to radical surgery when the entire prostate is removed. Male lumpectomy can be performed in ambulatory clinics with reduced complications, discomfort, and cost compared to radical surgery. And yet, over the last several years, our summit showed that male lumpectomy has remained experimental for more than 45 years. At the same time, when breast lumpectomy became a new standard of care. 3 years ago, in 2023, based on the summit recommendations, we established international working group to accelerate transfer of male lumpectomy from laboratories to patients. This study was initiated in 2025. In Massachusetts, at least 25% of men newly diagnosed with prostate cancer each year will benefit from access to male lumpectomy with significantly improved quality of life. Expected cost savings are estimated to be at least $40 million in procedural costs and additional $40 million in hospitalization costs.
After learning about minimally invasive treatment, many women 25 years ago were willing to have breast cancer screening, and we had seen a significant increase in early detection as well as decrease in death from breast cancer and related health disparities. We expect to see the same impact of minimally invasive treatment in men and prostate cancer.
Since 2021, our summit highlighted that equal access to high-quality care is the key factor in improving patient outcomes for all men and eliminating health disparities in Black men. It is particularly important now with so many novel diagnostic and therapeutic approaches, ensuring high-quality, personalized patient care. Without equal access to these advances in patient care, we will see a widening gap in health inequalities, including survival and mortality. Consequently, in 2022, AdMeTech launched Prostate Cancer Equity Resource Project in Massachusetts in collaboration with Mass General Brigham and UMass, with the mission to save lives and deliver high-quality care for all. More recently, experts at the Beth Israel Lahey joined this effort. Supporting organizations include Latino Health Insurance Program and multiple NACP branches located across the state. Emma Coyer serves as a manager of the Prostate Cancer Equity Resource Project. Emma is assisted by Erin Roberts, program coordinator, Craig McClay, patient educator, and other members of the AdMeTech Foundation's team. When you come to us, Emma will work with you, our team, Mass General Brigham, UMass, Beth Israel, and other clinical partners to expedite medical visits and address any needs you may have. Together, we empower each man to make informed choices that are right for him before and after screening, biopsy, and treatment.